Welcome to the deep dive. Today we're diving into something pretty fascinating and maybe a bit misunderstood. It's about extreme difficulty in making decisions.
Yeah, something called a Aboulomania.
Exactly, Aboulomania. We've got some really interesting material here that uh, tries to get under the skin of what this is really about.
That's right. We're going to be looking at key parts of a document that defines it, explores it. Should give us a pretty solid base for, understanding this quite complex issue.
Okay, great. Let's unpack this then. What we're really aiming for today is to get a proper handle on Aboulomania. Like, what is it exactly?
hmm
What might be behind it? How does it actually impact people's lives? And maybe crucially, how is it different from, those times when we all just can't decide what to watch?
Exactly. It's about shedding some light, bringing clarity to a condition that, well, you might not hear about every single day, but it can have a really profound impact on those who experience it.
So let's kick off right at the start. Defining Aboulomania. It's quite a word, isn't it?
It is. And it actually has quite a bit of history. The term was first coined, believe it or not, way back in 1883
Wow, 1883. By who?
by a neurologist, a brain doctor named William Alexander Hammond.
Hammond, right. So what was his definition back then? Must have been quite different.
Well, he put it in pretty stark terms. He called it a form of insanity characterized by an inertness, torpor, or paralysis of the will.
Paralysis of the will. That sounds intense. So definitely not just taking a bit longer to pick an ice cream flavor.
No, precisely. That's the absolute key thing with bulimania. The indecisiveness becomes, well, pathological. It's way beyond just, struggling with the dinner menu.
It's obsessive.
Yeah, it's an obsessive level of difficulty with making choices. It's not just being slow. It's like that core idea. Hammond had a fundamental paralysis of the will.
And the sources mention it's often linked with other challenging mental states like anxiety, depression.
That's absolutely correct.
Yeah.
A bulimania rarely just shows up in isolation. It's typically found alongside anxiety, stress, depression, significant mental anguish, really. It's usually part of a larger picture of psychological struggle.
Which you can easily imagine must have a huge impact on just daily life functioning.
Oh, definitely. It severely affects social functioning. Think about it. If you can't make decisions, even simple interactions, basic responsibilities, they become incredibly hard to manage.
Yeah.
And sadly, in the most severe cases, the distress and dysfunction caused by this condition can actually contribute to thoughts of suicide.
Gosh, that really underscores how serious this can be. Okay, so the material we have also touches on the brain, doesn't it? What might be happening inside when someone experiences this kind of extreme indecision?
Yes, and what's fascinating here is the role of a specific part of your brain, the prefrontal cortex.
Right, the decision-making hub.
Exactly. You can think of it as the control center for rational choices, planning, that sort of thing.
Okay, so what's going wrong with this control center in a bulimania? Or what's the theory?
Well, the prefrontal cortex has, a limited capacity. It can only juggle so much information at once. The idea is, for people with the bulimania, this system might get overwhelmed much more easily.
Even by small things.
Yeah, even by decisions that might seem trivial to others.
So the brain just sort of stalls, gets stuck trying to process everything.
You could think of it like that, yeah. And this can lead to what people often call paralysis by analysis.
Ah, I've heard that term.
Right. They just overthink every single possible outcome, constantly focusing on what might go wrong. Fear of making the wrong choice becomes paramount.
That sounds absolutely exhausting, mentally draining.
It really is. And for someone with a bulimania, this isn't just, a fleeting doubt. Things like a lack of information or the struggle to weigh up different options, the fear of the outcome, these can become completely consuming obsessions.
So even tiny decisions can feel massive.
Exactly. That's the key insight. The brain's processing capacity just seems overwhelmed.
Okay, so this is clearly, like you said, a whole different ballgame than me dithering over what shoes to wear. Our sources are really clear about differentiating a bulimania from just everyday indecisiveness.
Yes, and that's such an important distinction to grasp. Look, lots of people experience indecisiveness sometimes. It's pretty normal.
Right, like me staring into the fridge for 5 minutes.
Exactly. But the crucial difference here is the degree of it, the sheer intensity. A bulimania involves this level of obsession that you just don't typically see.
It's crippling.
It is. It's not just about wanting to take your time or weigh your options carefully.
Yeah.
It actually stops you from functioning properly.
And that's when it crosses the line into being clinically significant.
Precisely. If we look at the criteria, say
Hmm.
from the DSM-IV now, Aboulomania isn't specifically listed in the latest DSM-5, but the older framework is still useful here. Indecisiveness becomes part of a mental health disorder when the symptoms are clinically significant. That means they're causing real distress or seriously impairing the person's ability to function in their daily life work, relationships, just getting by.
And what about that idea of having too many choices? That
Right.
feels like something we can all relate to sometimes.
Oh, absolutely. There's research showing that when we're faced with, say, a huge wall of different jams in a supermarket, sometimes having too many options can actually be demotivating.
Right, you just walk away.
Yeah, people might actually buy less because the choice is overwhelming. But again, it's important to stress this is still distinct from the obsessive, debilitating indecision we see in Aboulomania. That feeling of being overwhelmed by choice is usually temporary and situational.
Okay, got it. So how does this actually manifest? What are the main symptoms someone might show if they have a bulimania?
Well, the symptoms really paint a picture of someone who's deeply struggling with independence and autonomy. You often see a significant lack of self-confidence,
Hmm.
and they might actively try to avoid spending time alone.
Because decisions feel harder alone.
Possibly, yeah. Facing choices solo might just feel too overwhelming, too anxiety-provoking. High levels of uncertainty and anxiety are very common.
Especially before a decision needs to be made.
Exactly, that anticipatory anxiety. It can even lead to sort of mental blocks, where they just feel like they can't think clearly about what to do. Their mind just goes blank.
Almost like their brain freezes up under pressure.
Yes, that's a good way to put it, a kind of decision-making paralysis. You'll also often see them trying to avoid taking personal responsibility for decisions.
Shifting it on to others.
A real reluctance to be the one making the final call, yeah. The actual process of making a decision tends to be incredibly drawn out, very difficult, and they often really struggle to function independently without leaning heavily on support from others.
So they become quite dependent on other people's input or guidance.
That's a very central part of it, yes. They also tend to overanalyze situations to an extreme degree,
Ruminate.
constantly. And then, even after a choice is somehow made, there's often this dysfunctional post-decision behavior, worrying, second-guessing, reassessing, even over tiny things.
It never feels settled.
Right. And as we touched on, they can become completely fixated, almost obsessed,
Right, yeah.
with the fact that they can't make decisions. It becomes a source of intense frustration and distress in itself.
And you can easily see how all of that would put a massive strain on relationships, family, friends.
Oh, absolutely. Maintaining healthy, balanced relationships can become incredibly difficult when this level of indecisiveness is dominating someone's life.
You know, it's interesting. The sources also point to a connection, maybe an overlap with other conditions, particularly OCD, obsessive compulsive disorder.
Yes, that's a significant point. There seems to be a considerable overlap in symptoms between Aboulomania and OCD.
Like what specifically?
Things like pathological doubt, that constant uncertainty, and of course, impaired decision-making, those are hallmarks often seen in both conditions. In fact, some researchers suggest that many people diagnosed with OCD experience a type of pathological indecision that looks very, very similar to Aboulomania.
So the obsessive thinking patterns in OCD might kind of fuel the extreme indecisiveness?
That seems like a very plausible link, yes.
Yeah.
And it's not just OCD either. Indecision is also pretty common in depression, for instance.
Right.
And it's often associated with having OCD tendencies, even if someone doesn't have a full diagnosis. These are all conditions that researchers have linked in various ways to Aboulomania.
It really sounds like a complex web, doesn't it? All these interconnected mental health experiences potentially playing a role.
It really does.
Which leads us to the big question. What actually causes a bulimania? It doesn't sound like there's one single, simple answer.
No, definitely not. We don't have, hard empirical evidence pointing to one specific cause yet. The general understanding, though, is that it likely develops from a combination of factors.
Nature and nurture again.
Pretty much a mix of environmental factors and biological ones, likely interacting as a person develops.
We talked about the prefrontal cortex earlier. Is that still considered a potential piece of the puzzle in terms of causes?
It is, yes.
Mm-hmm.
Given its critical role in decision-making, it's certainly a prime suspect. We know from research on people who've had injuries or damage to this brain area that it significantly affects their ability to make choices.
Okay.
So the current thinking, or speculation perhaps, is that people with Aboulomania might have some kind of irregular functioning in their prefrontal cortex. Maybe it's not processing information efficiently, leading to that constant overanalysis and uncertainty about outcomes.
Right. And on the environmental side, it seems parenting styles come up quite a bit in the discussion.
Yes, that's definitely highlighted as a potential contributing factor. Some researchers propose that certain parenting styles might contribute to the development of bulimania, especially maybe in kids who already have some biological predisposition.
What kind of styles are we talking about?
Things like being overprotective or overly authoritarian, maybe very intrusive, or over-involved parenting. These approaches can sometimes unintentionally foster dependence.
So the child doesn't really get the chance to practice making their own choices and build confidence in that?
Exactly. The parents might, without meaning to, sort of reward the child for being dependent and maybe subtly discourage attempts at independence. This can plant seeds of doubt about their own capabilities.
And sometimes the parents' needs are involved too.
That's suggested as well, yes. Sometimes this over-involvement might stem from the caregiver's own need to feel needed, which inadvertently reinforces the child's lack of autonomy.
The sources also bring up the impact of negative social experiences, like bullying.
That's another really important environmental piece, yes. It seems people with Aboulomania often report experiences of social humiliation, particularly bullying, during their childhood or adolescence.
And bullying is linked to other issues too, right?
Absolutely. Bullying is well known to be linked with a whole range of adverse mental health outcomes: anxiety, depression, low self-esteem, which, as we've discussed, are often connected to bulimania anyway.
So the bullying could exacerbate things.
Potentially, yes. The feelings of shame, insecurity, maybe a deep lack of self-trust that can result from being bullied. It's thought these could play a role in triggering or worsening the condition.
It sounds like a really negative cycle could get set up, where these bad experiences just reinforce a feeling of helplessness.
Exactly right. The individual might internalize this belief that they're just incapable of being independent, of making good choices. And this belief might then be subtly reinforced by caregivers.
How so?
Well, as a result, they might start to, perhaps unconsciously, act helpless or indecisive, which then prompts others to step in and take care of them, make decisions for them.
Which just proves their internal belief, right?
Precisely. It reinforces the whole cycle. So you've got this complex interplay, likely between biological vulnerabilities and these kinds of environmental risk factors.
Okay, so if someone listening thinks, this sounds like me, or maybe someone they know, what's the actual process for getting a diagnosis? How is it assessed?
Right. Well, the first step is usually to consult a general mental health professional. Their initial job is crucial. They need to rule out any underlying physical illness or perhaps neurological damage that could be causing the symptoms.
How do they do that?
That would typically involve things like physical examinations, reviewing the person's medical history thoroughly.
Okay, makes sense. And assuming physical causes are ruled out.
Then, the next step is usually a referral to a psychiatrist for a more detailed psychiatric evaluation.
And that involves?
That usually centers around a clinical interview. The psychiatrist will talk in depth with the person, asking detailed questions about their symptoms, their history, how these issues affect their life day to day.
Are there specific, like, lab tests or brain scans for bulimania?
Interestingly, no. There aren't any specific laboratory tests or scans that can definitively diagnose bulimania at the moment.
So it really comes down to the clinical picture, the interview and observation.
Largely, yes. However, psychiatrists do have various assessment tools they might use to help them get a clearer picture and support their evaluation.
Like what kind of tools?
They might use standardized personality inventories, like the MMPI, that's the Minnesota Multiphasic Personality Inventory, or the MCIV, the Millen Clinical Multi-Axial Inventory.
Okay.
They might also use what are called projective tests, things like the Rorschach ink blot test or the thematic apperception test, the TAT. These can sometimes offer deeper insights into a person's underlying psychological processes and conflicts.
Right. So once a diagnosis is made, what does treatment typically look like for bulimania?
Psychotherapy is generally considered the main preferred approach. The primary goal is to help reduce the impact of the symptoms on the person's life.
And those symptoms often overlap with other things, right?
Exactly. As we've said, the symptoms can often resemble those seen in OCD, anxiety, or depression, so therapy often draws on techniques used for those conditions too.
What's the main aim of the therapy?
Fundamentally, it's about helping the patient become more independent, more confident in their own ability to make decisions. Assertiveness training, for instance, might be used specifically to help build self-confidence and empower them to make choices for themselves.
And what about medication? Is that ever used?
Medication might come into play, yes, particularly if the abulomania is occurring alongside other diagnosed mental health disorders, like clinical depression or a significant anxiety disorder.
So it treats the co-occurring condition.
Right. In those cases, medication can help manage the symptoms of the depression or anxiety, which in turn might indirectly alleviate some of the indecisiveness associated with the abulomania. But it's not usually seen as a direct treatment for the abulomania itself.
So it often sounds like a combination of therapy and maybe medication, depending on the broader picture.
That's often the case, yes.
Now, our sources do point out, and it's probably important to mention, that there are some limitations in how much we currently understand about abulomania.
Yes, that's a really crucial point to acknowledge. One key limitation is that a lot of the existing research isn't solely or even primarily focused on abulomania itself.
It's more indirect.
Often, yes. It might look at related aspects like, say, the general impact of bullying on mental health or how the prefrontal cortex functions during decision-making in broader contexts. It's not always zeroed in specifically on abulomania as a distinct condition.
So the research is a bit fragmented, maybe?
Yeah.
Scattered across related fields?
To some extent, yes. And another significant factor is that even though it's a recognized clinical phenomenon, Aboulomania isn't currently included as a distinct diagnosis in the main diagnostic manual, the DSM-5.
Ah, okay. Why is that significant?
Well, not being in the DSM can sometimes make it less visible, perhaps less likely to be diagnosed consistently. It can affect research funding, insurance coverage, things like that. It just doesn't have the same formal standing as disorders listed in the manual.
It definitely sounds like a condition that could really benefit from more dedicated, focused research then.
And
Okay, so as we start to sort of wrap up our deep dive today into Aboulomania, what are the main takeaways, the key things you think our listeners should remember?
I think firstly, it's just vital to grasp that abulomania is a distinct and genuinely severe form of indecisiveness. It goes far, far beyond just, having trouble making everyday choices.
It's pathological.
Yes. And secondly, it seemed to stem from this complex mix of factors, potentially neurological roots involving the prefrontal cortex, combined with environmental influences like parenting and early life experiences.
Yeah.
And thirdly, the impact is significant. It can really affect a person's daily functioning, their quality of life, and their relationships.
It really does make you pause and think about the whole process of decision making, doesn't it? Like, where is that line between the normal hesitation we all feel sometimes and something that actually needs clinical attention?
Exactly.
Yeah.
It highlights that point where a common human experience shifts from just being a minor difficulty to becoming a major source of distress and impairment. And it often seems intertwined with other significant mental health challenges like anxiety, depression, and OCD.
Yeah, it certainly gives you a fresh appreciation for the simple act of making a choice, even a small one.
It really does.
And maybe a final thought for you to mull over. It makes you wonder about the broader pressures in our society, doesn't it? This constant emphasis on making choices, being decisive, being independent. How might those societal pressures interact with someone's individual vulnerabilities, potentially contributing to conditions like abulomania? It's just something to consider, that whole spectrum of choice and the potential burden that decisions can sometimes carry, especially in our complex world today.